Hello, everybody. My name is Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. And thank you for joining us for another one of our educational webinar sessions. So a couple of very, very quick housekeeping rules. The session is being recorded, and it will be available in a couple of days on our website. So if you've missed it, you'll be able to watch it on demand. We've scheduled 25 minutes for today's session, so you should be good to go for your next meeting coming up just shortly after that. Because of the amount of people we have today, we're going to use Zoom's chat functionality, and you'll find that right at the bottom of your screen. Please submit any questions that you would like to our guest speakers, and we'll try to answer as many as we can during the session. If we miss it, I promise we will get back to you afterwards. So today's session is called What Should Employers Be Looking For in Wellness Right Now? And to walk us through this topic is Dr. Tyler Amell, who's the Chief Health and Strategy Officer at MediKeeper. Dr. Amell has a special guest joining us today, but I'm going to let him make those introductions. So Dr. Tyler Amell, we're looking forward to today's session.
Great. Thank you very much, Daryl, and good morning, everyone. We really appreciate you taking time out of your busy schedules to join us here today. As Daryl mentioned, the focus of today's conversation is what should employers be looking for in wellness or well-being or health promotion or population health or whatever term that you want to use. And I'm going to get Philip to join in on that train in a second. Right now, as we look to 2024 with regards to this market segment. Now, joining me today is Philip Swayze, who is the Vice President and East Region Health and Performance Practice Leader at Hub International. He's also a board member and Vice Chair at the Worksite Wellness Council of Massachusetts, and he is also a think tank member at HERO, so Health Enhancement or Research Organization, and sits on the Workforce Mental Health Committee as co-chair. Now, I myself have been a past member of the think tank, great organization, great group, some really cool things that have been done there. Philip, do you want to briefly introduce yourself and say hi to everybody?
Yeah, absolutely. Good morning, everyone, and thank you, Tyler and Daryl, for having me. Always love having these conversations, as you mentioned, I'm wearing a number of different hats. The topic of workplace well-being or health and performance, as we call it at Hub, or depending on how deep you get in the data, it's population health management, health promotion. We go by a lot of names here, and I think ultimately it is about providing solutions and helping improve the life for and well-being of the humans right on the other side of this kind of stuff. So I think that's the lens that I try to bring to any of the work that I do, whether it's at Hub and helping to co-lead to manage the national practice, or sort of the programming and the guidance that we provide through the Wellness Council or HERO. We're just trying to help people do a little bit better job.
Mm-hmm. Absolutely. Thank you for that. So Philip's email is up on the screen, as well as the URL for Hub International. Now, as is customary, the affiliations and disclosures are up on the screen right now. As you all know, especially those who've attended our webinars in the past, we aim to do around 10 of these a year on a variety of different topics, all evidence-informed, all research-focused, all outcome-driven. I wear a few hats as well. So I'm the Chief Health and Strategy Officer at MediKeeper. I'm also on faculty and registrar at Pacific Coast University for Workplace Health Sciences. And those of you who are frequent attendees will notice that there's a bit of a change in the organizations that I'm part of as well. So there is, at the end of 2023, the National Wellness Institute, NWI, was folded into the International Foundation of Employee Benefit Plans, as well as WellCOA, who joined the, so that's the Wellness Council of America, who joined IFEBP back in mid-2023. So I have since joined the advisory council for WellCOA, and I still sit on the executive board of the Work Wellness Institute as well. My email is up on the screen, and as well my LinkedIn contact please feel free to reach out, join. I'm very active on LinkedIn, as Philip I know is as well. I post upwards of several times a week on evidence-informed practice in workplace health and productivity. So that's everything from primary prevention on the front end, wellness, well-being, population health management, all the buzzwords that Philip mentioned earlier, right on through to work disability management accommodations, and pretty much everything to do with integrated workplace health. As is customary, I usually do a brief review of recent conference presentations and webinars I've given, as well as what's coming down the pike here in the near term. I had a very, very busy fall. I was doing one keynote or plenary a week for around, I think, 9 weeks in a row. So it was pretty busy. So I really didn't do too much on the conference speaking side in December and January, but things are moving forward as we're in February now. So obviously this webinar is one of our series. Next week, I'm giving the day 2 keynote on the role of technology in innovative health behavior change, and that's for the International Foundation of Employee Benefit Plans Health Innovations Conference. A few days after that, I'm giving a webinar and participating on a panel for Caravan Wellness on advancing wellness in healthcare professionals. And then we're actually scheduling our next MediKeeper webinar for March 20th. So we have not decided on a topic yet. So if there's an area that you'd like us to do a little bit of a deep dive on and promote some of the research and evidence from a practice perspective, please don't hesitate. Send me a note on that, and we'd be happy to include that in the conversations. Now, I don't know what it is with 2024 conferences, but most of them have delayed announcing keynotes, plenaries, breakout sessions. A lot of the folks who solicit applications to speak, pretty much every single list that I'm on, and I'm on a lot of them, have delayed. So my speaking schedule is not yet set for the rest of the year, aside from, I think, one event in San Antonio, Texas, and then a couple more in Florida. But other than that, there's probably 15 waiting to be scheduled right now. So much more to come in that front. Now, with that being said, super happy to have Philip here today. He's a consultant, great resource, obviously working in the space, great reputation, some very interesting opinions, obviously backed up on practice and evidence, and of course, a lot of consulting experience there. Now, when I started out, I spent 10 years in university getting trained. And then my first real job outside of university, I was hired in an HR department in human resources. And it was quite interesting because the folks in HR, they're quite focused on payroll. They're quite focused on attraction, recruitment, and retention. Benefits, part of the conversation. Labor relations, huge. But health was not on their list of priorities. This was a big organization, around 16,000 employees. And I found it quite fascinating because here I am, a young, passionate, recent university graduate thinking, okay, we're going to change the world. We're going to help people become healthier, become more productive from an integrated workplace health perspective. And, let's really get the ball moving because people are unnecessarily sick. There's a lot of people being impacted by largely preventable health conditions, from chronic conditions through to workplace injuries and illnesses. So I was in for a rude awakening through baptism by fire in human resources. And so, my first question for Philip, given the fact that he's a consultant at Hub, is, how are your clients? How are the folks that you're dealing with from a human resources, from an employee benefit, as well as a health promotion, population health perspective? How are they positioning, the well-being initiatives for their people in 2024? I'd love to get your opinion on this.
Yeah, no, it's a great question. Tyler, I think that the answer to this kind of continues to evolve. Hub did its market outlook, and in that survey, 68% of respondents said that well-being initiatives they believe have an impact on employee vitality. So, what we're seeing is more of a shift towards how do you support people in a more genuine way? Like what things can you do to remove barriers to well-being? I think that there's also a lens through that I know at Hub we're particularly focused on, which is like creating a quality employee experience, right? How do the benefits and the wellness programs that you offer, and if you combine them with good policies and authentic messaging, like how does that support overall engagement in the work at hand? I think that there's more conversation and more effort being put into the blend and the total rewards, and how wellness is really more integrated into a larger narrative around employee performance, employee well-being, and having them feel like they're part of something larger. I think that to me is I'm hearing more calls for support with mental health. I have more and more clients who are looking for support with caregiver solutions, considering, as I mentioned, sort of policy changes. So I'm seeing definitely a shift towards more kind of human-centric approaches, which I think sort of dovetails into the culture question that you have.
Yeah, it does. Now, as we get into the culture side of thing, I'd just like to unpack one thing you said, and that's, genuine support and initiatives on behalf of employers. Obviously, the opposite of that is disingenuine. Can you give us as an example of what you would consider genuine versus the opposite?
Yeah, absolutely. I think when you're acknowledging sort of elements around social determinants or more honest barriers that people have to addressing their well-being, you get away from what people are calling sort of wellness washing, right? If you've heard of greenwashing, it's like you say that you care about the environment, but it's just words. I think a more genuine concern is how a good example are leave policies. I'm seeing more work being done to reshape leave policies that more impact and support real life versus qualifying life events. I think, so to me, that's where like pet bereavement, like you might be, like if you have a dog, especially, or a cat, right? And your pet passes on, like that's kind of a big deal, right? And as a pet owner, you can like appreciate that and share some love on Facebook or something. But, an employer who says, we're going to give you a day off, right, to deal with that. I think that to me, those are examples of where there's been some shifting away from kind of transactional wellness or things where we're like, we super care about that, but make sure you get your work done. And this is like, no, we understand real life impacts and we're going to do something meaningful to address it.
So walking the talk, that makes perfect sense. So that's a perfect segue into the cultural aspects. As we know, culture, this has been a focus of a lot of organizations on promoting a culture of health and a much more positive culture and support, versus, negative type cultures and toxic sort of work environments in that perspective. So it takes a long time to shift and shape a culture into one that you want. And it really starts at the top. With regards to those policies, those procedures, those approaches to absence, leave, and disability that you mentioned. So love to hear your thoughts on how these sort of elements can play into that culture of health.
I think the people can see when we were talking about sort of disingenuous versus more genuine and authenticity. I think that the pandemic in a lot of ways helped some employers be more empathetic and more genuine because we're kind of all forced into a similar situation. And I think the cultural aspects and the lessons from that are that, communication needed to be a little more frequent and more personal. I think that other elements of culture, there was some research that was done several years back at Hero that looked at what does healthy culture look like? And it isn't, biometric screenings and step challenges and premium differentials. It's around modeling, it's around communication, it's around shared values. And I think when you implement like a leave policy, that says, I see you, I understand the challenges that you have as a person, that helps to build culture. You can also, it builds trust, and more trusting employees are going to be more likely to engage in benefits and programs and services. So I think that for me, when we look at the big picture, culture is shaped from the top, but culture can also be shaped, within an organization and creating a climate of well-being. Joel Bennett did some great work around creating a climate of well-being. And his data showed that if you have programs that focus on physical and mental well-being, and you kind of teach people to have more agency around that, that as that sort of feeling and narrative surrounds you, that it can have real health improvements that don't have to be top down. Ideally, you have both happening for you at the same time.
Yeah, and it comes down to, from my perspective, treating people as people and not widgets in organizations. So let's expand on that a little bit. So what does attraction, recruitment, retention have to do with well-being solutions? Because these are typically top of mind for many employers these days. So how do we have that conversation through the lens of employee health and productivity and all the fun stuff that goes along with that?
Yeah, Tyler, there's a stat, and I might not get it exactly right, but 40% of millennials in a recent survey said that they would leave for a lower paying job if there were great mental health benefits available to them. Right. And again, we've all seen some of the stats around like return to work efforts and how like the hybrid situation that we're probably never going to really leave, right? Especially in a knowledge-based economy, is influencing how people view work. I think the different generations have different expectations for the support that an employer provides, and places a higher value on some of the wellness solutions, which used to be nice to have. I think that some of these things are now becoming fairly, a requirement. And I think that attractive wellness packages help with recruiting, surprise, right? Healthier people, right? We all aspire to be healthier versions of ourselves. But certainly if we want that, then you're going to, by offering wellness programs in a meaningful way, you're going to get the people who care about that stuff more wanting to join your organization and stay with your organization. So I think that those are pretty important pieces of the puzzle when you think about, like, the big picture is, how does a healthier, higher performing workforce support your business outcomes, right? If that's kind of the lens with which you enter into the idea that offering wellness programs offers value, then the attraction, recruitment, and retention are critically important as you think about the objectives and the value you place on a well-being initiative.
Yeah, absolutely. I couldn't agree more. And I think back to my time, I used to sit on the board of the Integrated Benefits Institute, or IBI, and our business performance and business objectives linkage with health and productivity, it made up for a rather substantial portion. And it goes beyond the concept of, okay, well, here's our pharmaceutical benefit, these are anxiolytic drugs, these are antidepressants, that's our wellness sort of initiative there, to more of that holistic, more well-rounded, more tools in the toolbox sort of approach that you just mentioned. So I think that makes perfect sense. Now, let's expand on that a little bit, because the next logical question around linking business performance and health and productivity are the concepts of ROI, return on investment, as well as VOI, value on investment. So, from your experience and your practical knowledge of things in this space, how should employers be looking at these issues these days?
I thought for just a couple minutes, or maybe it was a couple years, that the ROI conversation was gonna, kind of fall off for a little bit, so that we could focus on value, we could focus on the humans. But they're important constructs. And I think that the way I articulate it, when I'm speaking to clients is everyone can see a value for the time and money they invest in well-being, but not everyone's going to see a return, right? So I think about a value of the investment are, did the time and energy and money that I invested in the wellness programs feel like there was value to me? And then, we can talk about what do you value? The return, medical return on investment, you've got to get much more prescriptive, right? You need to look at data with your point solutions. You have to be talking about risk management and population health management because, for sort of generic or more like lifestyle oriented wellness programming, it may help with recruitment and retention. You can improve employee satisfaction with, of course, which is weave back into that, but it's not a medical return on investment. So I think the proliferation of point solutions, hopefully the people who are carrying an armload of point solutions are measuring to see if they're working. And maybe there's value in that my company cares about me, so they're offering, a musculoskeletal program and a weight loss and a nutrition program, and those are really good things. But if you're not benchmarking and then measuring, then it's stuff. It's a lot of stuff.
Mm-hmm. Listen to you speak, Philip, reminds me of a colleague of mine, a psychologist, who used to ask a very pointed questions of an employer, and he would say, well, what is the value to you of a healthy employee? How important is their health to you? Is it $1 a month? Is it $12 a year? And he was quite brazen in his approach in that sense, and that always stuck with me with regards to that, because you mentioned point solutions. Obviously having platforms and integrated solutions makes a lot of sense. Making sure that they're in line with what your workforce is actually yearning for. What are folks looking for, and those sort of things. So I think they all come together quite nicely. Now, I think a logical extension of this conversation is the key success drivers, and I think you expounded a little bit on that, but let's dive into that one a little bit more deeply. And then something that you brought up in our prep call, which I thought was very interesting, is the things that you look for in solutions by vendors to really help flesh out those solutions for the employers that you work with. So it's kind of like a 1-2 punch question here.
Yeah, the key success drivers are going to be tied to the data and the metrics that you can provide. I think communications is critically important. We've talked about culture. We've talked about retention and recruitment. Like that requires, I think, authentic creative messaging. It requires good data. Listen, great workplace well-being is a blend of art, science, and technology. And so I think there also has to be great technology. And when I'm looking for a solutions provider that's going to support my client, like it's not a one-size-fits-all, but I need, an organization that is nimble. Listen, MediKeeper is a software company who knows health, right, and understands that. And so I think the ability to engage with an employer on their terms and to sort of modify your offerings to match the current resources they have, or to fill the gaps where they don't have resources, critically important, right? Having the data to then show levels of engagement to match up where you might have seen risk improvements or cost avoidance, that's I think is critically important. And listen, I'm happy with the work that MediKeeper's done for the clients I have, and I certainly know that those are elements that I look for: flexibility, good data, great technology, and great customer service. I think those are super important.
And good people too. So thank you for that.
Yes, no, and that's important, that you have to like what you do. Ideally, you also like the people you're doing it with, because it's work. but work doesn't have to feel hard. It should feel purposeful. And we're all here to create health improvement. So for me, that's the shared ingredient.
Oh, I like that phrase, shared ingredient. That makes sense. So, we're coming up on time. Is there anything you would like to conclude with? I really appreciate you taking time out of your schedule to join us here today. I think you and I speak relatively frequently, always looking for opportunities to speak together at events. This is the first time we've done it. I think this is, you're able to impart, your wisdom and your knowledge from an evidence-informed perspective, to a nice broad audience here. It makes a lot of sense to me. I'm nodding my head a lot of the things that you're saying. So, love to have a couple of closing sound bites from you before we turn it over to Daryl.
Yeah, of course. No, I've super enjoyed this, Tyler. I think, for me, it sort of comes back to, like, let's not forget that the goal is to help people, right? Let's remember that health choices are really personal things. I guess the other part, like, real change and behavior change is hard. And sometimes life can feel hard. I feel lots of people sort of struggling these days, but life can also be super amazing. And great well-being initiatives, if they're done right, can create some, really remarkable outcomes, and I think are worth doing.
Excellent. Well, thank you so much, Philip. Really appreciate your time today, and over to you, Daryl.
Yeah, well, those were such meaningful words to end, Philip. I don't think we're going to go to the questions now. So I'll say thank you to everyone that submitted them. We will respond to you through email. Appreciate them. Great words, fantastic content. Dr. Amell, Tyler, Philip, thank you so much for your content. Thank you for everyone for joining us today. A reminder, you'll be able to get a copy of this webinar on our website in about 24 hours. Thank you for joining us. This concludes today's session.
Thank you, everyone. Have a wonderful week.